right, now I'm going to talk about sexual and reproductive health in adulthood. And I'm probably going to have to break this up into at least 2 videos because there are more than one, there's sort of larger topics to include here. All right, so the first involves changes in sexual responsiveness, being able to experience pleasure from sexual activity. I mentioned previously when we went over emerging adulthood that is your peak time for sexual pleasure and orgasm. It's just easier. The body is most receptive during that time for most individuals. So most people, men and women, or people with male or female reproductive systems, will have decreased sexual responsiveness. They will have more difficulty with sexual arousal and achieving orgasm. It might take longer or not happen at all. Those with male reproductive system, those with a penis, may experience erectile dysfunction, difficulty getting or maintaining an erection. If you've seen the ads, you know that there is medication for that. There is often a lot of social stigma or embarrassment about having that particular issue, but it can happen as you get older and you have bodily changes. Other issues can simply revolve around things like body image. You get older, your body starts to look different, your skin starts sagging, it's easier to put on weight, you might be developing gray hair, not up here, but also down in the pubic area. There are various things that can happen that sometimes just makes adults feel less sexy, and so sometimes that can interfere with sexual pleasure. We do see that adults, even the ones who are getting closer to 65 than 25, adults still value sexual and romantic relationships. There are some individuals who identify as asexual or aromantic, but most adults, they do still desire emotional satisfaction as well as sexual satisfaction, and they'd like to experience physical pleasure from sexual activity. It is alarming or disturbing when they can't. It's something that they feel like that's a big loss if it happens. And some individuals will have extremely satisfactory sex lives, even well into their 60s and beyond, depending on the partner and other factors. All right. And so I always like to remind people, you don't reach a certain age where you're like, you know what? They don't need that anymore. They don't need that sex anymore. Don't care about that anymore. And I think a lot of it has to do with people not wanting a picture, like if their parents are still together, they don't want to think that they're still doing it. They might be. Like to mess with folks sometimes. Then we'll get to late adulthood and I might mess with it and say, folks, your grandparents. And they're, no, don't bring that up. All right, let's talk about some problems that will become more common as you get into adulthood. All right. Fertility is at its peak in emerging adulthood. In regular old adulthood, fertility starts to become more common. Infertility. Infertility. Especially when you hit 35. And then 40, there's another dip. Let's make sure you know what infertility is. A lot of students, I'll say, what is infertility? And they'll say, oh, that's when you can't get pregnant or you can't make someone pregnant. No, that's sterility. You just defined sterility. Infertility is different. Infertility means that you have been trying to become pregnant or get someone pregnant and you have not been successful. We don't know why, just that it has not happened. A lot of people say it's almost better to use the term subfertility than infertility because that way it doesn't have that drastic, like, you can't do it at all. Most people who do experience infertility, they have the capability of pregnancy, of reproduction. They just have more difficulty. And a lot of times there are unknown cases of infertility. And so infertility, typically to be diagnosed with infertility, you have to be trying for at least, depending on your age, at least 6 months or 12 months, depending on your age. Once you're older, they go with 6 months to get treatment quicker. But let's say for someone who is on the younger side, trying for at least 12 months and not getting pregnant. All right. What does trying mean? Some people are like, well, you're just having unprotected sex. Well, no, that's not enough because you have to be having it often enough that you have good odds of conception. Because we've talked previously, when we talked about reproduction, that whole menstrual cycle means that there are certain times where it is more or less likely that conception could actually occur. So if someone's trying to become pregnant, how often should they have unprotected sexual intercourse? Or they could be using assisted reproductive technology, which we will talk about next. Let's just talk about people doing it the old-fashioned way through heterosexual sexual relations, vaginal intercourse. All right. How often? Now, sometimes I'll have students, I'll open it up, I'll say, what do you think? And they'll be like 3 times a day, right? Actually, no. That would lead to low chances of successful fertilization because you use up the sperm. The sperm-making equipment has to recuperate and recover. So it's better to do it every other day, working out to roughly 3 to 4 times a week. So 3 to 4 times a week, unprotected intercourse for 12 whole months with no pregnancy resulting. Now, does that mean no pregnancy ever resulted? No detected pregnancy resulted, because we talked previously when we talked about conception and fertilization, the majority of conceptions, they don't even make it past implantation, and miscarriage is common. And so you might have a situation where they had a successful conception but an early pregnancy loss. All right, but the idea is that's how you get diagnosed with infertility. It says nothing about cause, and importantly, you have male factor and female factor infertility. Many couples have both, and many couples have unknown cause infertility. And infertility is most common in nations where medical care is scarce and STIs are common. All right. That is not the U.S., all right? The U.S. does have medical care. In certain countries, like certain countries in sub-Saharan Africa, where they have less access to medical care, and they have they don't have the prevention programs and the medical access that we have for preventing or treating sexually transmitted infections, they actually have higher rates of infertility. We tend to give more attention to the U.S. because we're there. That I'm teaching in the U.S., so we get more attention to the home base. But we don't have the worst rates, but we do. Many couples, many individuals and couples experience this. 12% of U.S. couples are diagnosed with infertility, and some of these cases can be explained by them being older at the time that they are trying, because the older you are, the lower your odds, particularly when the person with the female reproductive system in the couple, particularly when that individual is over 35, you do see a dip in infertility. All right, so let's just give you a sampling of some of the known causes of infertility. Sometimes it's just bad luck. Sometimes it's just that you just never timed it exactly right for sperm and egg to meet successfully, or you might have had successful conceptions, but they didn't make it past implantation. A lot of cases are probably explained by bad luck. But when there's a known cause, let's talk about male factor infertility. This can involve problems with the sperm. It could have problems in the sperm count, like how much is present, mobility and motility, their swimming ability, because some of them are not good swimmers. Some will have blockages that will cause problems. Sometimes they may need surgeries to help with that. Because things are so much complicated for the female reproductive system, there's a long list of things that could contribute to infertility. So it could be problems with the uterus itself, with the fallopian tubes, like fallopian tube blockage. They could have conditions like endometriosis, is when you have uterine tissue, the sort of stuff that you build up during a menstrual cycle and that you flush out during a menstrual period. Well, sometimes that tissue will grow outside of the uterus, and it's not supposed to do that, and that causes extreme pain for the person, and it can interfere with fertility. You can also have problems with the ovaries themselves. You can have problems with ovulation. A very common condition is PCOS, or polycystic ovary or ovarian syndrome. Very common cause of infertility, and in this situation, the ovaries kind of go overboard. They get very, very bumpy. Lots of follicles swell. And they have all these little follicles, but none of them gets big enough to be released as an egg. And so individuals with PCOS, they often have problems with having longer cycles, irregular cycles, difficulty with ovulation, just unpredictability of their cycles is a big issue. And sometimes they will have problems with their hormonal levels and the balance. Sometimes the thing is, all of those follicles, all of those swollen follicles, they release estrogen, and they will have high levels of estrogen. And sometimes the high levels of estrogen will be met with a bodily response of producing more testosterone, and that's not optimal for trying to get pregnant. And sometimes that extra testosterone means that they'll have extra body hair and other issues from having more testosterone that you would expect in an individual with a female reproductive system. And so that's another big one. There are other ones. There are other ones out there. There are lots of different causes. And many people, they never find any kind of known cause. Now, if an individual or couple are experiencing infertility, notice I say an individual because sometimes you are trying to get pregnant trying to become a single parent on purpose. We do have some folks who will do that, and they often are using assisted reproductive technology, or sometimes you have a couple going through infertility and they're using this ART, assisted reproductive technology. The A does not stand for artificial. Assisted reproductive technology. All right, I'm going to do a separate video about ART.